Obesity creates a biological environment that fosters cancer development and progression. It disrupts the body's hormonal balance, fuels chronic inflammation, and alters insulin signaling, all of which can contribute to the transformation of normal cells into cancerous ones. These effects are not confined to one area of the body, but impact multiple organs and systems, which is why obesity is now strongly linked to at least 13 different types of cancer. The consequences are both widespread and severe. One of the key mechanisms is excess body fat's ability to increase levels of estrogen and other sex hormones. This is especially dangerous for hormone-sensitive tissues such as the breasts and endometrium. In postmenopausal women, fat tissue becomes the main source of estrogen, and elevated levels of this hormone have been directly associated with higher rates of breast and endometrial cancer. These cancers are not only more common in individuals with obesity, but also often more aggressive and harder to treat. Insulin resistance is another major factor. Obesity leads to higher circulating levels of insulin and insulin-like growth factors, which promote cell proliferation and inhibit apoptosis, the normal process by which the body eliminates damaged or abnormal cells. This unchecked cell growth increases the risk of developing colorectal, pancreatic, kidney, and liver cancers. These are among the most lethal cancers, and their association with obesity is both well-documented and deeply troubling. Inflammation plays a third critical role. Chronic low-grade inflammation, common in people with obesity, creates a constant state of immune activation. Inflammatory molecules such as cytokines can damage DNA, interfere with cellular repair mechanisms, and create an environment that supports tumor initiation and growth. This inflammatory cascade has been linked to cancers of the esophagus, gallbladder, and stomach, all of which tend to have poor prognosis when detected late. Obesity also physically alters the body in ways that may increase cancer risk. For example, excess fat around the abdomen is associated with a higher risk of colorectal cancer, while fat deposits in the liver may progress to non-alcoholic fatty liver disease, eventually leading to liver cancer. In men, obesity has been connected to advanced prostate cancer, likely due to hormone disruption and delayed detection, as higher BMI can make tumors harder to feel during exams or imaging. Despite this evidence, many people remain unaware of just how many types of cancer are linked to obesity. The misconception that cancer is primarily driven by genetics or external toxins can obscure the role of modifiable lifestyle factors. This lack of awareness hampers prevention efforts. Obesity is not merely an issue of aesthetics or cardiovascular health. It is a major carcinogenic factor. Efforts to reduce obesity rates are crucial not only for preventing diabetes and heart disease, but also for lowering cancer incidence and mortality. Unfortunately, reversing obesity is far more difficult than preventing it in the first place. Once established, obesity sets off metabolic and inflammatory patterns that are hard to undo, even with weight loss. While interventions like diet, exercise, and medical therapy can help, they require sustained effort, social support, and often medical supervision. The reality is stark. Obesity doesn't just increase cancer risk, it increases the risk of some of the deadliest and most difficult to treat cancers. Without broad public health campaigns, structural policy changes, and better education around this link, the number of obesity-related cancer cases will likely continue to grow. This trend will put further strain on healthcare systems and deepen health disparities, particularly in populations already struggling with access and resources. Ignoring the connection between obesity and cancer is no longer an option.